This segment is sponsored by iChiro Clinics and Peak Performance Integrated Medicine. Hey, why not skip the knee replacement? If you're suffering with arthritis in the knees, pain in those joints, you don't have to go straight to knee replacement. Dr. Michael Quast is here to tell us about an alternative that's gaining traction in his office. Good to see you, Dr. Quast.
Hey, good to see you.
I think all too often people rush right into that knee replacement when you're finding success doing some things, multiple things around helping people find relief.
Yeah, so the current model out there is you just give somebody pain pills over the counters until it's so bad you have to go to prescriptions and hope they don't get addicted, and then you just go to a knee replacement. That's kind of like the model that's being used. And what we're finding is there's something before the replacement, because those are risky. Just Medicare alone says over 5,000 people die a year just from the knee replacements, not to mention over 17,000 that have infections and all these other complications, right? So it's a risky thing. Not saying that it's never needed. Sometimes it is, but what we think and what we're seeing is there's many things we can do to try to help that person before they get to that last resort of a replacement. And part of it is just understanding, first off, how arthritis even occurs. Most people think it's just age, right? Everybody's like, well, I'm just getting old. And if it was just age, then every joint in your body would be worn out the same, because all your joints are the same age.
Yeah, right.
And you just never see that, right? You never see that. It's like certain ones are worn out more. And what we're finding is what's wearing them out is the muscular compression around the joint. So when your muscles are tight, they'll squeeze those bones together in the joint, and then that cartilage is under a compressive force. Same thing with people who are overweight. The extra weight will compress that joint and make it wear at a faster rate. So it's not just age, it's compressive force. And that's where the therapies come in. So if we can get a person to do all of the therapies that we're doing to try to change the muscle and get the muscles to hold that joint in a more opened position, not with all the compression, while combining the regenerative therapies. So the stem cell therapies, the PRP therapy, trying to regenerate everything you can on one side, and on the other side doing the therapy and putting that all together. That's where we're seeing the amazing results happen.
Yeah, like describe some of the results that you're seeing.
Yeah, so we just had a guy come in. He just did a testimonial on Google for us. He was told he had to have a knee replacement and didn't want to do it. So he came in and we did that process that I just kind of laid out. And, now we're about 3 months in and he's like pain-free in his knees, moving around. He's doing things. It's great. And we see that time and time again. And so we just believe, do the safe, natural stuff first, like this. And if we can't get there, we can always then refer to a knee replacement or whatever other joints the person's having problems with, right? Because it's not just knee, it's shoulder, it's hip. The same process works for those as well.
Okay, that was going to be my question. The same thing applied elsewhere on the body, you get the same kind of results.
Yeah, it's interesting because, it's just trying to do all the stuff we can. And like we've talked about before, everybody wants to find like this magic bullet. Well, I did this and then I did this and then I did it. None of that worked. And what we're finding is you're really, what we're trying to do is manage better odds. So the odds of getting results are better if we do a bunch of different things all together. The odds for that person go up, and that's where we're seeing the real breakthroughs and people getting good results.
All right, folks, if you want to learn more about the practice or make an appointment, get in there. Maybe you're suffering with knee pain or somewhere else in the body. Check them out. You can go to their website, peakperformanceintegratedmedicine.org. Dr. Quast, thank you.
Thank you.